As the patient balances on their uninjured leg, have them place the arm of their uninjured side around the back of your neck. Once the patient is steady while leaning on you, help them balance as both of you make your way to safety. Stand directly in front of the injured patient on solid ground. Squat down so the patient can lean on your back. Rest the patient's arms over your shoulders and cross their forearms. Grasp them firmly, then lift the patient with your legs, not your back, and move them to safety. Face your partner and grab each other's forearms with a firm grip, creating a basket. Your arms should be placed on their lower back and under their knees, with their butt in the middle of the basket. Have the injured patient lean back into the basket you created. When all three of you are comfortable, remove the patient to safety. First, you want to check the scene to make sure it's safe. Once you determine it's safe, call 911 before you approach the patient. Tap and shout to check the level of awareness of the patient. Look at the patient's chest, feel the chordoid pulse, and place your ear next to their airway to listen for breathing. If they are not breathing, place your hands in a diamond form on the mask placed over their airway. While your hands are positioned in a diamond shape, use them to tilt the head backwards to open their airway before giving oxygen. Give them 2 1-second breaths. Once 2 breaths have been given, interlock your fingers with your dominant hand on top. As you place your hand on top of their chest, make sure your palms are touching their chest directly between their nipples. Lock your elbows and do not let your fingers touch their chest. Begin 30 chest compressions before your next set of breaths. After 3 sets of chest compressions and breaths, check the patient's level of breathing and pulse. If they are not breathing, watch them carefully and check their vitals every 15 minutes or until EMS arrives. First, you must make sure to identify the cylinder as oxygen. Check for cracks and leaks and remove the protective seal. Crack the main cylinder to remove dust and debris. Position the regulator and align the pins. Then hand tighten the T-screw on the regulator. Open the main cylinder valve and check the pressure. Attach the oxygen delivery device to the regulator. Once you've attached the oxygen delivery device to the regulator, set the liter flow to the desired rate for your patient. Insert the 2 tips into the nostrils with the tab facing out. Then position the tubing over and behind each ear and secure the adjuster by sliding it. Repeat the steps shown before, but this time select a mask. Position the mask over the patient's face and supply oxygen. If a patient is coughing, encourage them to keep coughing, and if they stop coughing or can no longer breathe, call 911 and start the Heimlich maneuver. Get behind the patient and position one leg between the patient's leg in lunge position. Place one arm across the patient's chest and have the patient lean forward. Then give 5 blows between the shoulder blades. If the object has not come out, begin abdominal thrusts. Wrap one arm around the patient and make a fist with one hand and have the thumb on that hand be placed in the middle of the abdomen above the belly button. Grasp the fist and press into the abdomen, making an inward and upward thrust. Use 5 distinct thrusts to remove the object. Call 911 and then begin rescue efforts immediately. Go into lunge position while placing the infant on your forearm in a face down position. Maintain support of the neck, head and neck, and make sure to keep the mouth and nose open. Begin 5 back blows with the palm of your hand. If the object does not come out, then place the baby on its back while still supporting it with your forearm. Carefully turn him over, lower your arm, and begin to do 5 chest compressions with 2 to 3 fingers. Repeat the process until the item is forced out and the baby can cry, breathe, or cough again.